You wanted to know how you can tell what position your baby is inside of you. And ultimately, you can only tell this for sure by having an ultrasound done. An ultrasonographer or a trained doctor can look and see what position the baby's actually in. The position we want them to be in is the vertex position, and that is where the baby is head down in your pelvis. So you have the pelvis here, you have the baby's head down. Now, a baby can also be breech or head up with feet down, foot down, or bum down. So another question you had is where would you feel movement based on the baby's position? And if you imagine the baby being head down, they're in the fetal position. If they're laying in your belly like this, then you're likely to feel lots of kicks and punches on the side the baby isn't sitting in, because the side that they are sitting on will have the head down low and the backbone and the bum on top. And you'll also feel some shifts and movements in the bottom of your belly. If the baby is in the breech position, the movement may feel a little bit different because the baby's arms and legs are up top. So around 28 weeks, 25% of babies are breech. At 32 weeks, only 7 to 14% are breech. And by full term, or 37 weeks, only 3% are breech, meaning 97% of babies have figured out that they need to be head down. So it's not cost effective to ultrasound everyone and see what position the baby is in. In the latter end of the third trimester, your doctor will look for position when they're checking you at your appointments. They can do this a few different ways. One is called Leopold's maneuver, where they fill the woman's belly and they try to feel for the head and the backbone and the bum and kind of get a sense for how the baby's oriented. When we check your cervix, we can also feel for a head if you're dilated at all and get a sense for what position the baby's in. If there's any questions about it, then of course the doctor will ultrasound to determine if the baby is indeed breech or not. Now, a lot of women also want to know, if my baby is head down at the end, are they likely to stay? And it kind of depends on what baby this is for you. If it's your first, then it's likely. But if you've had babies before, the uterus is more stretchy. And of course, that's defining the space your baby can move around in. So if it's a little more stretchy, the baby will have more ability to move around and flip. So a baby could possibly be like vertex at 37 weeks, breech at 38 weeks, vertex again at 39 weeks. I've seen that a lot in practice over the years as a labor and delivery nurse. There are many other factors that go into the position a baby will be in, though. The umbilical cord, the placental location, and also the shape of the woman's uterus will determine how they're lying. A baby can actually also be side lying. That's called transverse position. Now, if your baby's breech at the end of pregnancy, what can be done about that? There's a lot of different things out there that you might read about that you can try in order to see if your baby will flip spontaneously, but there's not really any science behind that. And like I've heard putting a bag of cold peas on your belly to kind of scare the baby into the head down position. But you have to remember, there's a lot of layers between your skin and the baby, so they're not really feeling that. Some people have talked about acupuncture or standing on their heads. I definitely don't recommend standing on your head, because that's a hazard for anyone who's not pregnant, but especially when you're pregnant and your center of gravity is shifted. Talk with your doctor about it, and if they've determined that your baby's in the breech position, they'll talk to you about the plan for delivery. In some cases, the doctor determines that an external cephalic version, or ECV, might be appropriate for the woman. As long as the placenta is in a good location, the umbilical cord is not around the baby's neck, there's enough fluid surrounding the baby, they might say, let's try to rotate the baby. So we bring you into a hospital setting, go up your belly, and from the outside, the doctor tries to manipulate the baby into the head down position. So if your doctor talks to you about that, then you can ask them more specific questions and decide if it's something that you would like to try. In the end, if your baby is still breech when it's time for delivery, then your doctor will recommend a C-section, because complications can arise by delivering a baby vaginally that is breech. If you have more questions in the future for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.